A look at America's youth and the challenges of their mental health. The Surgeon General sensitive to the issues they're facing, making it a priority to help.
This morning, disturbing statistics showing a rising suicide rate.
In the decade prior to the pandemic, there was a 57% increase in the suicide rate among young people. And today, nearly half of high school students are telling us that they feel persistently sad or hopeless.
The largest increase among males ages 15 to 24, an 8% increase from 2021 to 2022. But overall, the highest increase seen in youth ages 10 to 24 and Black children, nearly 37% higher than the year before. The mental health epidemic hitting college campuses like North Carolina State, where 7 students have died from apparent suicides this year, to small communities like DeKalb, Illinois, where Nevaeh Mitchell was a cheerleader and active in her community.
She was my goofball. She was always cracking jokes, making people smile.
But she struggled with her mental health.
Did you have a sense that Nevaeh was struggling more than she had been?
No, her father and I thought everything was fine. Looking back, and I've thought back a million times, as you can probably believe, but I can honestly say no.
In 2021, 22% of high school students reported seriously considering attempting suicide. 18% of high school students made a suicide plan during the past year. 10% of high school students attempted suicide one or more times, with 3% resulting in injury.
We've also seen that LGBTQ youth have also been suffering with rates of self-harm and suicide.
The Surgeon General says research shows it takes an average of 11 years from when a child first has symptoms to when they actually get care.
If you have any inkling that your child is struggling, do not wait. Do not be embarrassed. Do not think that you can fix it yourself. There are resources and people that can help you. Have those conversations. As a parent, sometimes it's not your job to fix it, but to get someone who can, and that's okay.
And so, of course, May is Mental Health Awareness Month, and it's not just youth, it is everyone, every demographic, so many people across this country struggling. So it is important to know there are resources there. Yeah. Get the help if you need it. If you or someone you know is struggling with thoughts of suicide, call or text the National Lifeline. They have made it so easy. 3 numbers, 988.
Yeah, the numbers are just so staggering.
They are.
It's really a matter of diagnosis, identifying it, and providing the resources to people who need it.
I'm so glad you did this story because we need to be talking about this.
That's the thing, to break the stigma. We've got to talk about it. So here we are, 988.